All right. Okay, thanks everyone. Well, today, very exciting news. We've got over 1,000 new health workers about to hit the field across Queensland, which is excellent. And in relation to doctors, 834 junior doctors, and I'm advised this is the largest intake ever, so this is fantastic news. And those 834 doctors will be deployed right throughout Queensland, across Toowoomba, Coomera, Bundaberg, Redcliffe, you name it, they'll be out there. And it's great to see so many of them enthusiastically looking forward to their new careers. And we wish them all the very best, because we're such a decentralised state and we know how important it is to be able to send these doctors out across Queensland. Also too, we're meeting the new AMBOs. We're going to have 200 new ambulance officers out there on top of the 250 that we have already planned to recruit this year. So this is excellent news as well, and we just met some of the new officers, and they are of course looking forward to going and working in Metro North, Metro South, and some are even going up to Cairns, which is fantastic. And I had the privilege of meeting some AMBOs last week when I was up in Townsville as well. So this is great to see our health professionals out there. We know how important health is to Queenslanders. And in more good news, the Health Minister is also going to announce that we have some shortlisting of tenderers for our hospital expansions across Queensland as well. So I'll hand over to Yvette.
Thanks, Premier. It is exciting news to know that we've got over 1,000 new health workers joining us, our new interns, so a 5% increase on the number of interns that we had across the state last year. And those 834 new interns will be invaluable for us to grow our profession over coming years. I had the great opportunity to meet some of the new interns at Redcliffe Hospital on Friday. We already have some interns hitting the ground, and we will have all of these interns rolling out over the next few weeks across the state. So it will be an exciting time for them. Of course, many, many years of study to get to this point, to be able to walk into those hospitals and call themselves doctors. But we are so grateful that they've chosen Queensland Health as their home to practice in health. And I even spoke to some of them, as much as we want them in the public health system as well, about working in the regions and also considering being GPs into the future, because we know we need more general practitioners. And of course, our new paramedics, 200 additional paramedics on top of the 250 that we were recruiting this year. And it's wonderful to see some of the new recruits who are about to hit the ground. The majority of these new graduates today will be going into southeast Queensland, because we know that is where our pressure points are right now. We know that that's where we need additional staff on the ground. So it's wonderful, and I wish them all the best as they embark on their career with the Queensland Ambulance Service. As the Premier said, we're also announcing today that we're going out to tender on our hospital and health plan. So this is our big budget announcement of almost $10 billion. 3 new hospitals. We've got 11 expansion of existing hospitals happening, as well as we've got numerous new health facilities in our rural and remote communities as well. So one of which I'll be visiting this week. So these new tenders that are going out, we've done something a bit different to ensure that we can get our capital done, out the door and built in the time that we have committed to. And so we have shortlisted a number of companies. We've got 12 companies in Queensland that have been shortlisted as potential tenderers. They will now go through a tender process over the next 12 weeks, and in April we'll be able to announce the successful tenderers who will be building those 3 new hospitals and 9 of the hospital expansion projects, $8 billion worth of projects. This is 19,947 construction jobs, almost 20,000 construction jobs alone just in the construction of these projects. And we know the difference it's going to make when we open up those beds. And these projects alone that we're going out to tender for at the moment, 1,980 additional beds over the next 6 years. So I'm really excited that we've been able to get those tenders and this shortlist done to show that we've got the companies out there who we can have the confidence will deliver on our capital works. and that we can get these beds opened in time to, obviously, with new staff coming on, making sure that we are getting the capital and we're getting the staff in place for that future growth as well.
Okay, have we take some quick questions?
There's obviously some specialist shortages in the region.
Yeah.
Still enough to do that, and what can you do to relieve that?
Well, the specialists are your next category up, and I'm quite sure it'll be raised at National Cabinet as well, National Cabinet's meeting this week. I think it's a big issue, not just in Queensland, but across Australia. It's about attracting those specialists out to rural and regional and remote parts of the country, including Queensland.
How many doctor vacancies are there actually, which do you have like a breakdown?
No, I'll ask the...
We'll have to...
yeah.
So obviously vacancy rates changes all the time, but we can get a point in time number of vacancies. It's not just in doctors, it's nurses, it's allied health workers. There is a shortage of health workers across the nation and across the globe. We know the National Health System in the UK have 96,000 vacancies, so that is extraordinary. At the same time, we're reaching out to UK health workers saying come work in Australia, and I'm really pleased that the most recent outreach we did in the UK only a couple of weeks ago, I was told that 180 nurses have shown an interest through an expression of interest program. So that's really exciting. We're going to be doing the same thing with doctors for the UK as well. But it is a challenge, and I've been talking to my New South Wales health colleague as well. They've got challenges with midwives and obstetricians as well. They've got areas that they just haven't been able to have full maternity services operating in some of their hospitals, particularly in the region. So it is a national issue. All colleagues are talking to each other. Of course, we're talking to the Commonwealth as well.
They're bringing in 834. How many left in the last year?
Oh, look, again, I'd have to get you that figure. We try to hold on to them, and the work we've been doing, particularly over the last 12 months, the workforce summits that we've been holding, we have not just been focusing on how do we attract health professionals, we have been focusing on how do we retain them. So that's really critical for us, making sure we're not burning them out, making sure that we're looking at their needs, their work practices, how do we actually improve the work practices of our health workers so they're not burning out and they're not leaving us.
The numbers going out must be as important as the numbers coming in.
Absolutely. That's why retention...
Going up or down?
Well, again, I'll get the accurate figures. I don't want to just guess, but retention is as big an issue as attraction. We know that. There's people leaving the profession because they're tired, they're burnt out, and we want to make sure, and they're getting poached by other jurisdictions. So, I saw a report only yesterday, $1 million being offered to a specialist. I mean, that's extraordinary. So we are trying to make sure, and our enterprise bargaining negotiations, we're offering the best wage increase, the highest wage increase in the nation for our health workers in the latest round of enterprise bargaining. So those are the sorts of things we're trying to do to attract and to retain our health workers.
Youth justice. You announced your 10-point plan.
Yeah.
Will you commit to looking at changing the sentencing guidelines of the Paralympic Act? I know some people have raised issues, but we suggest magistrates need to use detention as a last resort. How do you think that specifically changing the wording?
Look, we've announced our 10-point plan. It's there for everyone to see. We're working on the legislation at the moment. I'll have more to say leading into Parliament.
When you increase the maximum sentences, surely it's pointless unless you suggest or guide those magistrates to actually look at detaining these juvenile offenders as opposed to...
I think one of the most important issues here is taking into account the previous bail history. That is absolutely significant, and that is something that is part of our stronger laws for community safety.
Last month there was a rally in Queensland.
Yes.
TV is obviously one that's been an issue for the government. Some time ago, we spoke to the AG about it. Is that again something that needs to be re-looked at, or will it change the recommendations in that?
In relation to the prevention of domestic and family violence, we have continued the committee. It is always refreshed and always has new people on that committee, and their job is to constantly be looking at the issues across Queensland.
You said that you want the courts to do their job.
Yeah.
What are you doing to actually open up the courts, make them more transparent and make them more accountable?
Well, in relation to the courts, where at the moment the Attorney General is looking at those specialised magistrates to deal with these issues. When I was in Townsville last week, I had a series of meetings with people, and there's a lot of great work that's happening for 90% of those young people, those 90% of young people who may have had issues with family violence, issues where they're involved in drugs or chroming. So with 90%, we have a whole range of government agencies actually working together. No, this is but let me finish. Working on that, and there are some remarkable stories of how those programs are turning young people's lives around. What these laws are aimed at is those 5 to 10% that are basically, going through those cracks in the system. So that is what these laws are aimed at, and this is in response to what's been happening out there in the community.
So often the courts are closed, and no one knows actually what happens behind those closed doors. And we see so much anger about these cases that was happening in the courts, and it's finally revealed. Journalists are locked out, Queenslanders are locked out, people do not know what is happening there. And then we hear you saying the courts should do their job. Why not open up the courts so journalists can go in, Queenslanders can see the process and know what is happening?
Yeah, well, these are young people as well, so they do have a right to have their cases heard before the magistrate, and like we said too, 90% of those people get their lives turned around. Look, I'm quite sure that's something that the Attorney General can look at.
Premier, do you go to Philly?
Yes.
And caucus retreats next week, will you be allowing Jim Madden to attend?
In relation to Jim, I'm aware that the party is doing a independent investigation. I am looking forward to hearing the results of that independent investigation from the State Secretary, but as you can appreciate, she has to be able to conduct that investigation independently, so I won't be saying anything more publicly until it's finalised.
If he's found to be a workplace bully, will you ensure that he's expelled from the party?
Well, I'm not going to deal with hypotheticals, but I've said very clearly that I don't accept it, and I look forward to seeing the results of that inquiry.
Were you aware of the two payments, financial settlements made from the Parliament to his former elected staffers?
No, and they're matters for the Parliament, and nor should I be made aware of them. Okay?
What is Queensland doing with the rapid antigen test that are due to expire in the next 3 months?
Oh, good question. Do you know the answer to that, Yvette?
So there's obviously quite a lot of stock that we have when it comes to tests and a whole lot of things. We've been getting rid of additional stock over the past year anyway. We've been sharing our supplies with aged care facilities and disability facilities as well. We've also provided stock to GPs, as I understand. So we've been trying to get rid of excess stock. My department is always tracking anything that is expiring. Inevitably, sometimes things expire, but we've been very careful in trying to get rid of anything that was close to an expiry date and sharing that out earlier, because we knew we didn't need as much as what we used to have.
How many have you been thrown out?
Right now, I'll have to check. Yeah.
Kathy Allen, Paula Brisotto and Justin Howe still employed by Queensland Health?
I believe they are still on suspension. I'd have to check whether status has changed, but I am aware, well, they were under suspension. They certainly are not back in the workplace, but I'd have to check whether that has ended. But I know that can be quite a lengthy process to go through the show cause and whether there's been a response, whether there's been any request to review those decisions, so I'll find out where the show cause process is. One thing I would like to say while we're all here today is the good news. I've been advised this morning that our locum in Gladstone is arriving on a plane today and will undertake his orientation. this afternoon, and they'll be meeting with hospital staff tomorrow to work through operationally what date they'll be able to open up phase 2 of the maternity services at Gladstone Hospital. So that's really exciting news. We've been really careful not to say too much until we knew that he was arriving, but I've been advised and confirmed this morning that the locum is arriving. We'll be on site this afternoon, and over the coming days they'll work through all of the operational issues to get that phase 2 of the services started again. Well, as we said over the last couple of weeks, that we were hoping this locum was going to start. That will allow us to go to the 24/7, so we've already had the planned caesareans. This will be the 24/7 emergency care, so any emergency caesareans. In relation to all services, we've still, I'm being told it's still sort of mid-year because we've got 4 doctors that at this stage will be coming on over coming months, including some from overseas. So I'll do everything possible to make sure those processes are as smooth as possible and as quick as possible. But of course there's a whole lot of things we don't control around just the visa approvals and also their registration accreditation through the colleges, which the colleges have got to make sure that these people are appropriately skilled before they walk in the door, because that is paramount. I do not want anyone who's not fully skilled and appropriate working in these hospitals around maternity services. Oh, look, there's no doubt that whenever there's media like this, it causes us problems in attracting staff. It does. And so, that's why every day I stand up talking about how great our health system is. It has its challenges, but anyone who's ever travelled, anyone who's ever worked overseas, knows that we have an amazing free public health system in this country, and that's something we should be really proud of. But there is a lot more work to do, and we are facing challenges that are global challenges right now when it comes to health workforce. And as you've heard me say time and time again, with ageing population, with our population, everyone wants to live in Queensland, which is fantastic, but that comes with pressures. Of course, we've got less people taking up private health. Those who have got private health in the regions don't have the private hospitals to go to or the specialists, so they're still using the public hospital system. I mean, all of these issues, plus the way the funding is modelled at Commonwealth level, and GPs closing their doors. In my area alone, there is no longer a GP bulk billing. That really concerns me, because I don't think, we know for a fact, not everyone out there can pay $80 up front to do a telehealth appointment to get a script filled, where they'll get some of that back, but they've got to have the money up front. If they stop going to to GPs, if they stop getting their scripts filled, they will end up with chronic illnesses in our hospital beds.
Just back on to Dean May, when Dr. Wright was raising all the concerns about the lab, something that was consistently said by the department and by herself was that relying on the fact that the lab had been accredited by NATA. Do you think NATA's failed, and does the federal government need to look at a review of how it's accredited labs?
From what I have learnt since, no, I don't believe so. What I was being advised of at the time was that accreditation would look at all the issues that was being asked of me at the time. And in fact, the accreditation doesn't go to the different methodologies and protocols that they're using. So,
do you think it should be doing that?
Well, look, that is a conversation worth having. I have no doubt that every single state and territory is looking at what is happening in our forensic services and looking internally at their own systems and going, are we doing the best we can? Are we using the right measures? What are we doing? I have no doubt every jurisdiction is watching this very closely and looking at their own systems. And I'll be meeting with health ministers next month and certainly asking them if what they're seeing in their own systems and whether we should be having a conversation around accreditation. But the fact is, this is an issue really that comes down to a small number of individuals who have allowed this to happen, and what appears to be deliberately covered up the decisions they made and why they made those decisions. And I was lied to. That's all there is to it. I was lied to as a minister. So that's not about accreditation, that's not about protocols or anything else. That's about people not doing their job, and they should be held accountable for that. It's based on a whole lot of different issues, so not just population, but the particular needs of the areas, not just the individual hospitals, but the HHS region as well. So they look at a whole lot of factors, which is what we're doing when we decided where we should build and expand our hospital systems. It's not just about population, it is what the different needs are of that population when it comes to health, ageing population, all those sorts of things.
Oh, so last year we asked you about 50/50 health funding, and you said that there was an announcement you'll be able to say something very soon about 50/50 health funding or a funding agreement with the Commonwealth. Can you bring us up to date with
I think I was talking about, let me just double check, I think I was talking there about the Olympics, but I still support 50/50 health funding, and I know that health funding is, and health is always on the National Cabinet agenda, so more to say later on this week.
What's your priority?
Sorry?
What's your priority?
Well, it'll be good when I see the agenda. So when I see the agenda, but health's always on there. Okay? Sorry?
You mentioned, I think, last week.
Yep.
Funding.
Well, it won't be at National Cabinet. I will. Yeah. You have side meetings with the Prime Minister on different issues. Well, after I meet with the Prime Minister, I'll let you know. Okay. All right. Yeah, it was the Olympics. Yeah. Okay, that's right. Thank you. Thanks. All right.